Good afternoon. My name is Ashley Thomas, and today I will be presenting my anatomy project, which is on GERD disease. So, what exactly is GERD disease? GERD disease is also known as a chronic upper gastrointestinal illness, which is also referred to as gastroesophageal reflux disease. And GERD is characterized by the persistent and regular movement of stomach contents back up into the esophagus, which can lead to many signs and symptoms as well as many consequences and complications to the digestive system. GERD is also influenced by both pathologic and physiological variables. So let's get into the signs and symptoms of GERD. Now, number one, I have sour taste. A sour taste may result from stomach acid rising into the esophagus and reaching the mouth. With GERD, because it is a reflex, it's flowing back up the esophagus, so certain tastes and certain drinks or foods may be misconstrued for a more sour appeal just because of all that stomach acid still staying right in the esophagus. Next, I have burping. Burping, although, everybody burps all the time, with GERD, burping comes with an excessive amount. Stomach acid triggers more gas production, leading to many, many burps during someone's day-to-day life. Nausea is also another sign and symptom. Irregular esophageal contractions interfere with regular digestion, and these contractions may lead to nausea, which causes a person to be way more tired than what they are. Even though somebody might have had a good 8 hours of sleep, they still might experience some type of exhaustion during their day. Next is sore throat. Now, sore throat is caused by the inner layer of the esophagus and neck becoming irritated by stomach acid reflux back into the esophagus. So if we're constantly having that regurgitation up into the throat, that'll cause it to be sore. Next, a dry cough. Since GERD is primarily caused by esophageal irritation rather than an infection or overproduction of mucus, the cough that is linked with the condition is frequently dry. Whenever somebody has GERD and they are drinking water or they might be eating something, usually it's coming back up as a more acid. So the dry cough is usually caused by the esophagus constantly being used and constantly being sore. Now, lastly, we have our regurgitation. Now, regurgitation is caused by the inner layer of the esophagus and neck becoming irritated by stomach acid reflux into the esophagus. So I listed a few digestive organs involved, which, kind of affects that process of GERD. So I have the esophagus, which we already talked about previously with our sore throat, dry cough, etc. Next, I have the stomach, and the stomach is bringing that acid back up to the esophagus. And I also have lungs. Now, I put lungs because usually a lot of people experience fatigue, but they also experience shortness of breath after they constantly are regurgitating all day, or they're just tired. Their respiratory is just not working the way it should be. Next, I have my small and my large intestines. Due to all the stomach acid reflux coming back up, it's supposed to be making its way down. So to have bowel movements or to simply use the bathroom correctly, it's coming back up instead of going properly down the way it should be because of all that acid reflux. So I listed a few of our organs and how GERD might affect them. And starting with our small intestine, due to the secretion of digestive enzymes and negatively disrupting the small intestine's regular operation, it alters how well the gut breaks down food and absorbs nutrients. Along with the large intestine, acid and other stomach contexts may accumulate, a result raising the risk of reflux back into the esophagus rather than going out of the large intestine through the colon and where it should be going. Next, we have our stomach. Now, The stomach is also linked to heartburn, regurgitation, discomfort in the chest, and extremely trouble swallowing due to the stomach acid contents irritating the lining of the esophagus. Next, we have our mouth. Now, there's a lot that can go on with our mouth interfering with GERD. Bad breath is number one because of all that acid flowing back into your mouth and it's just stuck in your esophagus. It can furthermore damage oral hygiene practices, damage tooth enamel over time, and we have cavities, tooth decay, increased sensitivity to the gums, and light and taste of food. And next, lastly, I have my esophagus. Now, recurrent exposition to stomach acid can destruct the esophagus or cause erosions in the lining of the esophagus, which can also lead to discomfort, bleeding, and a lot of trouble swallowing. So here I have the etiology of GERD. GERD is brought on by stomach acid refluxing up into your esophagus or food pipe. Persistent acid reflux or reflux of a non-acid material from the stomach is caused by GERD. A circular band of muscle that surrounds the bottom of your esophagus relaxes during swallowing to let food and liquids pass into your stomach. Molecular mechanisms responsible. Here I listed a few of our responsible aspects of GERD, or things that are commonly known to be responsible for GERD and its symptoms. A rise in stomach acid that pushes against the esophageal sphincter increases pressure. Reflux results from the lower esophageal sphincter, which is also known as LES, and eventually defeats this pressure. There are several other causes of GERD, including anatomical ones, such as hiatal hernia, visceral hypersensitivity, and impaired mucosal resistance. So a few of our diagnosis and techniques include doctors assessing the pressure and movement of the esophagus. That way they can determine how well food and liquids move from the mouth to the stomach and whether problems with muscles or nerves into the esophagus may be the cause of GERD. And then a pathologist will examine the tissue under a microscope, while doctors may order an upper GI endoscopy to check for complications of GERD or problems other than GERD that may be causing your symptoms. Your doctor may also order an upper GI endoscopy to help diagnose GERD, depending on which approach that they like to take. Those are usually the most common approaches. So we have some current treatment approaches. So depending on a patient's severity of symptoms or how exactly they eat, what's their weight, their day-to-day life and living, a lot of these treatment approaches are different with each patient. So starting with minimizing trigger foods and drinks, usually the minor aspect of it all. We can cut out alcohol, caffeine, spicy and fatty foods that are high in fat, which we know can aggravate those symptoms and cause an acid reflux. But for more severe or long-lasting GERD symptoms, we might need to have prescriptions or over-the-counter medications, such as omeprazole or Prilosec, Prevacid, or Nexium are frequently used. Now, these drugs restrict the stomach's ability to produce acid. However, if GERD is a long-lasting effect in a patient and it's not receiving any type of improvement, or we're mostly seeing a decline, surgical techniques are offered when lifestyle modifications and medications fail to provide the desired results. some research advances that I have researched and looked at. This one had brought my attention a lot, which is brought by the New York Academy of Sciences. Now, within the New York Academy of Sciences, their journal research had discussed how protein pump inhibitors are the drug of choice with GERD. However, they should not be the main approach with GERD, because they have they have unmet clinical needs in GERD, and they also have a lot of symptoms and side effects, which is, instead of progressing and moving forward with GERD, it's seeing a high decline in patients, or at least half of them, because the percentage was 40 to 55%. Although there's more research being done on that topic, they have just posted what their research was so far, and I found that to be interesting and applied it to my PowerPoint. And here's my works cited page. Thank you.